Hello, I'm Alexandra Galvin, and I'm a senior researcher at the Center for Social Justice, and I'm going to be taking you through a brief presentation on our latest addiction policy report, where we look at illegal drug addiction here in the UK, as well as examples of international policy and practice. Looking at the state of addiction right here in the UK, we know that drug-related deaths have reached their highest peak since records began in the 1990s. Tragically, in 2023, we saw 5,448 individuals lose their lives to drug poisonings. That's an 84% increase from over a decade ago. Within that decade, we've also seen over 13,000 babies born with neonatal withdrawal symptoms, which means that they are affected by their mother's drug use. And we know that this issue disproportionately affects the most disadvantaged communities. NHS hospital inpatient data tells us that hospital admissions for drug-related mental health and behavioral disorders are 8 times more common in the most deprived areas of England. Much of what we're seeing is happening because of a changing drug market. We know that synthetic opioid deaths are now 17 times higher than they were in 2021. And we're starting to see other drugs such as xylazine, a deadly animal tranquilizer, affect some of the drug market here as well, tragically taking its first life in May of 2022. As part of this research, we wanted to go abroad and have a look at what other policies in other countries that are grappling with similar issues have put in place and what the effectiveness of that might be. In British Columbia and Canada, a decriminalization pilot started taking place in January of 2023. Since then, they have seen a fall in drug-related offenses by 77%. However, this has not had a significant effect on overdose death rates. It's now at 6.9 individuals per day and has increased by 5% since the pilot began. In Portugal, which is often cited as the prime example of decriminalization policies, we've seen that a fall in treatment funding as well as rehabilitative programs is coinciding with a rise in overdose deaths. In the UK, when we consider legalization of cannabis, it's important to consider certain factors. For instance, the Adult Psychiatric Morbidity Survey tells us that 2.3% of adults show signs of cannabis dependency. And 87% of young people report cannabis as their problem substance when they enroll into treatment programs. That makes it the #1 problem substance among people under the age of 18. We also know from the CSJ's original polling that almost a quarter of 18 to 34-year-olds said that they would try cannabis if legalized, which is a consideration given that 87% of young people find it a problem substance already. The CSJ conducted 14 focus groups with individuals with lived experience across England and Scotland. And one of the key findings and recurring themes that we had from these focus groups was treatment deserts, or areas where people didn't feel as though they could access treatment appropriately. So in order to contextualize this a little bit better, we sent a Freedom of Information request to the Care Quality Commission in order to map out where exactly the treatment organizations are in the country. If you look at the map over here on the right, you can see everywhere in England that the Care Quality Commission has a registered service that provides residential accommodation for individuals with substance misuse problems. The Northeast, which has had the highest rate of drug-related deaths for the past 11 years, actually has the lowest number of inpatient residential accommodation services for individuals struggling with substance misuse, with only 3. And we also know that funding has decreased by 60% since 2012, leaving much room for improvement. One of the key elements that came out of focus groups was the role of law enforcement. It's important to consider that drug-related offenses have some of the longest outcome wait times for any nonviolent offense, with an average of 29 days. We do know that there are examples of good practice when it comes to law enforcement and diverting people away from the criminal justice system and towards treatment. In Durham, for instance, the cost savings are approximately 160,000 per year for the police force that has this in place. And this has been replicated in Australia with its own cost savings of $2.98 for every $1 that's spent. Our own original polling found that the current policies and procedures around drug-related offenses and strategies are seen as ineffective by police officers themselves, with 74% claiming so. Some other examples of good practice that we've seen involve problem-solving courts, which the CSJ has recommended in the past. This is a holistic way of trying to understand the root cause of someone's criminality and to rebuild their lives and embed them into the community properly. There are huge cost-saving implications for problem-solving courts, and an average saving could be £74,000 per case. Some of the top line recommendations that we have coming out of this report are for the government to take an evidence-based and phased approach when studying international examples to contextualize it with our own current system and the culture that we have here in the UK. We want the spending review that's coming up to recommit to long-term ring-fence funding for drug and alcohol treatment services. We'd also like to see the evaluation of Scotland's much anticipated safer drug consumption facilities to take into account things like recovery rates and referral pathways for individuals who are struggling with addiction. We'd like to see a national system rollout for non-fatal overdose tracking, as well as wastewater testing to better understand what the current drug supply looks like. Furthermore, we're interested in doing deep dives into drug-related deaths as provided by the coroners, specifically at a local level. We'd like to see offenders being steered towards treatment rather than the criminal justice system, which could be easily done through the two-tier out-of-court disposal framework. Individuals who are receiving opioid substitution therapy, such as methadone, must also be receiving psychological support in tandem in order to tackle the root cause of what their addiction issue may stem from. We're also interested in public health campaigns that are actually geared towards the social and environmental consequences of drug use, given that this is one of the most exploitative industries that exists. We've seen examples in places like Sweden, as you can see on the right here, where young people who may want to initially engage in drug use are able to become aware of some of the more social and environmental consequences that come with supporting an industry such as this. That concludes the presentation, but you can read more about the report and the entire series of research that we've done on the CSJ's website.